Hi, welcome to the Medication Mistakes Manager presentation. My name is Victor Virueña from the California Intercontinental University. We have a big problem. Medication mistakes, prescription errors, confusion over drugs with similar names, inadequate attention to the synergetic effects of multiple drugs and patient allergies, handwriting identification, the poor or illegible handwriting by the prescribing physician kill or harm more than 700,000 patients annually in the United States and cost millions of dollars in civil suits. For this reason, the Hospital Council approved a plan to reduce the medication mistakes. The plan incorporated the most advanced techniques to assure a successful implementation. The plan had 5 basic steps. The first is to disrupt the old behavior. The second is to activate the new behavior. The third is to reinforce the new behavior. The fourth is train through repetition. And the fifth is to maintain to retain. A functional structure change is not an easy task. By changing to a functional structure, organizations seek to bring discipline and efficiency to an operation. Functional structure helps the organization achieve efficiencies of operation and standardization of offering. Lewis' theory states that if you want to change the behavior, you need to change the context. Implement change into the organization requires to break the existing patterns of behavior or unfreeze the group member habits to create dissatisfaction and set a changed state of mind. The second stage of change under Lewis' theory is the concept of moving when the group members change from one behavior to another. Finally, the third stage is referred as refreezing or reinforcement of the new desired behavior. The proposed solution for the medication mistake problem is the new prescription system. Under this system, the computerized physician order entry, or CPOE, will include all prescriptions for medicine and treatment will be entered into the hospital IT network. Computer entries will be available to all hospital staff, including both treatment and pharmacy staff. The system will catch all prescription errors, incorrect dosages, duplicate requisitions, patient allergies, and even adverse impact statements of multiple medications being prescribed to a patient. The system will also display the patient's complete medical history as well as the latest clinical guidelines for treatment. The right path to achieve our goal is by leadership and cross-functional teams. According to Spector, leaders often attempt to impose change on their organization. The results are often disappointing and frustrating. That's why leadership actions and mobilize adapt behavior within an organization is necessary. Effective leadership shapes the behavior of employees. When members of a team feel equally responsible for the outcome for effort, teamwork is enhanced. In order to encourage teamwork, organizations can take care to ensure that the team members have the appropriate skills to perform the task effectively. In order to ensure the success of the new method, the Hospital Council agreed to create a paid training, feedback, and incentive program. This program carried out the following steps. Our training program includes an intensive CPOE for physicians, nurses, pharmacy staff, and administrative staff. Also, a role-playing training. Our feedback program includes a real-time feedback and a 360 feedback. Remember, a 360 feedback is a performance feedback geared for peers, subordinates, supervisors, and customers. Also, we include a self-appraisal every 3 months. and an anonymous feedback through the email at feedback@hospital.com. Our incentive program includes monthly bonus for the best team of the year, and the creation of the Medal of Achievement to the best team. As managers, you will be clear in the pay-for-performance philosophy in this hospital. Pay-for-performance is the pay that is tied to the performance in the form of either a merit raise to base pay or an incentive bonus that does not increase the base pay. We will create a monthly bonus and an annual bonus. Bonuses based on the overall performance of the organization make a symbolic statement recognizing the shared purpose and responsibility to all employees and organizational units. As intrinsic reward, we also create the Medal of Achievement to the best annual team. Remember, any change when imposed from above risks energizing resistance. This is why we need to involve employees in the change process. We're going to create a pilot unit. In this case, will be the pediatric unit, and we will start the new method in this pilot unit to evaluate the results. We need to boost the extrinsic reward, let the employees to know that they're gonna get raise payment, promotion, and so forth provided by the organization to the employees. And intrinsic reward to boost the feelings of pride, satisfaction, and self-esteem that accrue the individual based on the performance on the task. This is going to be achieved by the creation of the Achievement Annual Medal. Thank you for watching. Now it's time to answer your questions. If you are interested to investigate more about the topic, please check these references. Thank you.